Well, I'm Thomas Trevort. I'm a nurse practitioner here at Neural Effects. I have a doctorate of nursing practice. I'm also the clinical director. I have a background in neuro and neurosurgery. I've worked for 6 years in neurosurgery, taking care of patients with brain injuries. It is important that after a person gets an injury to their brain, that they do something about it. It's not just something we need to cocoon or try and avoid stimulation. We need to do some active recovery, and we need to treat the brain. The brain is one of the most important things that you have. You can't function without it, and if it's not functioning the right way, it sure makes life a lot harder than it needs to be. So one of the things we wanted to do here at Neural Effects that makes us different than other concussion clinics is we wanted to be able to have all of our concussion treatment available under one roof, so that the patient has an easy experience. They don't have to wonder where they need to be and what they need to be doing. I think that they do a lot better being able to come to one location, receive an evaluation and an assessment from someone like me, and then I can set them up with therapists. And the therapists are here on site. And if the therapists feel like something needs to change, we've got this open communication. And then the patients follow up with me at regular intervals so that I can change the direction of treatment and therapy if it is necessary. And oftentimes, if a patient is referred to another local concussion clinic, they will get a good evaluation and an assessment, but that's about where it stops. There's not often a connection with the therapist that's doing the actual treatment. When a patient is referred to another concussion clinic, they may be set up for therapies, but they have to go to this end of the valley or that end of the valley to attend, say, a physical therapist's office or an occupational therapist's office, or somebody who's specializing in cognitive therapy. Whereas here at Neural Effects, we're going to try and cover all of that under one roof, so the patient doesn't have to worry about where they need to be, or if their doctors and treatment and therapists are communicating with each other. So after a patient has gone through a treatment process, or we've gone a couple of weeks and done an evaluation and an assessment again, they typically come back with significant improvement. Now, that doesn't mean to say every patient in 2 weeks is going to be better, but they're going to be better than where they were. Overall, the changes that are made during the treatment course here at Neural Effects are going to improve their life and their quality of life significantly, to a point that they feel like they can get back to living. So if you or a loved one are concerned about cognitive impairment difficulties, please schedule an appointment with Neural Effects for evaluation.